Hi everyone. Welcome back to my YouTube channel, Global Nurse Stories. I hope you're having an exciting moment and I hope all the previous videos are insightful. So I hope you've been able to learn one or two things and you've been able to learn from my guest experiences so far. Today, I have another guest in the house and we are going to another dimension of nursing. She's a friend, she's a sister, and I will allow her to introduce herself. I have Folayemi in the house. Good morning, Fola. How are you?
I'm good. Good morning, blessing. Thank you for the opportunity. Yeah, my name is Folayemi. I'm a registered nurse from Nigeria. So I immigrated to the United States 2019 through O'Grady Pitting International, and it's been great. It's been fun all the way, and I have met wonderful people like you, blessing. Yeah, thank God we met. Yes, you've been a source of help and inspiration. Yeah,
Thank
thank
you.
you.
So today, I want you to talk about it's going to be two-way dimension question. Uh
Okay.
the challenge, one particular challenge you want to talk about in your journey, and also any rewarding experience you've had in this journey.
Okay. Yes, the journey has been an interesting journey. Back home from Nigeria, I started as a nurse in the ward. I was working bedside. I worked various area, the emergency, pediatrics, a little bit of ICU. Then I transitioned into clinical preceptor. I was a preceptor for 2 to 3 years. I was precepting nursing students that come into the ward for their clinical practicals. So I did that for a while. Then I decided to come to the United States. So, and thankfully, the journey was smooth. So when I got into the United States, came in through the bedside through OGP. So I started as a nurse on the bedside too. That was med-surg. So after a while, I wanted something new. Like I wanted to transition into something new. After like 10 years, I'm like, I need to just start something new. So that was when I ventured into my master's. So I started my master's in nursing informatics, and it was a 2 year and 3 month course. It was a bit challenging, but it was worth it. So later after on, I was able to get a job, and in that field that helped me. So currently I work hybrid, and that's like I spend like few days in the office and the remaining days at home, and it has helped me like work-life balance. That's the goal, just to have a work-life balance.
Wow. So thank you because I could see all the credentials behind your name, masters in nursing science, BSN, nursing informatics. Nursing informatics is I'll say is a new aspect of nursing. Like most people are not really used to nursing informatics. Like my previous question was any challenging, but I could see when you are talking, you spoke both about the challenges and the rewarding aspect of it. How easy was it for you to navigate into this nursing informatics? Was it easy? And looking at the pay, some people have always been saying bedside is where the money is, bedside is where the money is. And I know everything is not about money, it's about your passion. So I want you to just tell us, my audience, how the navigation was for you. Were there resources? Do you have a mentor, or you just started all by yourself? Do you have anybody that put you through all these processes of getting your certification in nursing informatics And what informed you to go and do your master's in nursing informatics?
Yes, so thank you for that question. So back home, I've always been into technology. I've always had interest. I've always been techie savvy. So back home, we are being disadvantaged because we never had the computer documentation or the electronic health records. We are still doing paper chatting back home. But on coming to the United States, like the this land has many opportunity and the sky is the beginning. I saw myself in an environment where I could able to use all the techie savviness in me. Like the EHR, when we first came in, we were using Epic. Where I worked, the first hospital I worked, we used Epic. Then later on, we transitioned into Vocera. And I discovered that this thing is really what I wanted to do. Although it was not easy transitioning because I had to learn, I had to go for some courses, I had to do some data analysis, I had to do some short time courses, which were quite expensive though, because I didn't want to go into the field like a low novice, like I don't know what I was doing. So transitioning was a bit difficult, especially when it comes to the money aspect. We all know there's money in bedside. Like in bedside, you do the extra shift, you work the weekend, the holidays. But this one, I only work Monday to Friday and it's a stable salary. You only get increments if maybe annually. So that was a challenge for me. But I wanted a work life balance. I wanted to have time for my children. I wanted to have time for my home. I wanted to, like, in every area of my life, I wanted a balance. So the finances, all I needed to do was just to step down in my spending and live within my budget. So that was another challenge. And another challenge I experienced was I didn't at first get to see mentors to mentor me. It was difficult to come across nurses, especially say from Nigeria, that have my own,
Yeah.
accent, skin tone to mentor me. It was so difficult. But later I realized I had to go out there. Like I had to go for conferences. I had
Networking.
to network. Yes, that word, network. And along the way, I was lucky. I started meeting people, nurses, Nigerians that had done this, and they were able to like help me navigate, and it really helped. Because at first, even in the middle of the program, when I was doing my master's in nursing informatics, I was like, I don't have to do this. I need to switch. But because of the encouragement, people were like the people I met along the way, I had to just stick to it. And God willing, it all came to pass. Yes.
Wow, that was interesting. So, what advice do you have for someone that wants to do something different? I know most of our African people here in the United States, what we are used to when it comes to masters is nurse practitioner this, nurse practitioner that.
Yeah.
Some people don't really know there are other aspects of nursing that they can venture into, because just like you said, you already have passion for technology from home, so you working as a nursing informatics is not going to be that difficult for you because you have something that is driving you. It's something that is inbuilt, it's something that is in you. You'll be able to navigate yourself through whatever challenges you see on the way because you know you actually wanted it. You are not just following people. You know what you wanted and you went for it, even though it took you some time because you need mentor, but you were able to get at it. So what advice do you have for people that want to do something different, people that have passion for something like nursing informatics or any other aspect of nursing that is not the general one that people actually know about, and they don't really know how to go about it.
Yes. So, because you want to do something different, you have to be different. At first, it's not going to be easy, especially we nurses that immigrate to this place. You know, we came here, some of us came here with the mindset of, I want to make money. So, that mindset will go a long way in making you achieve your dream. So if you are a nurse out there and you want to do something different, be it nursing informatics or anything that you think others are not doing, you just have to look down deep within you and do that thing differently. You have to look at the cost. You have to sit and make sure it's something that is worth it. Something like, after you do this, how will it benefit you? Will it benefit your family? And mind you, there is still money in this profession. It's just that you have to grow. With time, as you start growing in your career, you go up the career ladder, you make your money, and also you have your work-life balance. So my advice is anybody that wants to venture into something different, just go for it. This land has many opportunity. Just make use of it. Grab it. Like, don't be distracted by what other people are doing. Be concerned about what you really want deep within you and
I
go for
think
it. Yeah.
so. Talking about work-life balance. So, what difference have you experienced from when you were working at the bedside compared to now that you are working hybrid? Is there any difference?
Oh my.
What were the what are the benefits?
There. Okay. There have been so many benefits for me individually and for my home, for my children, for my husband. It has been blessings all the way. Like, the work life balance is, I have time to do what I want to do when I want to do it, you
Wow.
know, and that money cannot buy, you know. Then I have opportunities to live that life with my kids, to go maybe PTA meetings. They don't want to go for sports. They want to go out. I have everything. I can do it at that particular time. Like, I don't have to wait for one paid time off before I do all these things. And also in for health, in my health wise, like, I won't say if you are in bedside, you're not healthy. Don't count me wrong. But I know myself. Like, I'm able to manage my stress level more. And I'm the kind of person that get things done more when I'm alone. I'm not alone now, but when I walk in a cool place without distraction, I'm more productive. So work-life balance is, I cannot, like, I don't know which word to qualify, which adjective to qualify. I've had, like, blessings from it, and it's been good.
Work weekends and holidays.
No, no way. I don't. That's why we call it work. Like, I don't work weekends. Like, I'm able to plan my weekend ahead. I'm able to plan my holidays ahead. That was what I wanted, right? And I got it, and it's
Thank
been good.
Wow, interesting. You want me to leave bedside though?
Yes, we want more people, more nurses.
Wow, this is interesting. So for my audience that want to do nursing informatics and they are looking for mentors, they look for somebody to guide them through. Can they reach out to you, please?
Definitely, I'm hoping. Like, yes, the more we had, the merrier it is. I'm open to people coming.
Mentoring
Like,
people.
yes, I want more nurses. Like, it's doable. You can, even if you don't know anything about computer, you can do it. It's very doable and it's worth it.
Wow. Has there been any time that you envy we bedside nurses? That, oh, I wish I'm still at bedside.
Um, the only time is when sometimes I crave to have hands on my patient. You know, sometimes that experience, but at the same time, I'm able to still fulfill that doing this job because I still advocate for my patients when it comes to the documentation, when it comes to making sure the right thing was done for that patient. Yes.
Wow, 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 wow. This is interesting. I love this conversation. So, my audience, this is someone that is practicing hybrid as a nurse in the United States. And yes, she is sharing her experience that she's enjoying it. And she's open to mentor whoever that is ready to pull the same path. Thank you. Thank you for offering to mentor. I appreciate that because I know a lot of people will be reaching out to you very, very soon. So, getting your certification, is it part of a requirement for your MSN in nursing informatics, or you just chose to add it to your credentials?
Yeah. So there's this saying, what is worth doing is worth doing well. So you can normally a nurse that has a BSN can go for the informatics without doing the masters and still be an informatic nurse. But I wanted more. I wanted to be specialized. I wanted to be recognized because there's something about being certified. Like once they believe, not even they believe,
An
it's known
expert.
that yeah, you are an expert in what you do. And moving along in this professional journey, I've been with a lot of people, mentors, they have it. So why can't I? Like it makes you more look you be more
Involved.
proficient, yeah, involved in what you do. So getting certified to me, it was a necessary step that I needed to take in this profession.
Has there been any time that your kids asked you, Mommy, why are you home? Why didn't you go to work?
Yes. At first, they were asking, like when I initially started in this profession, like 2 years ago, why you not working? And I'm like, I'm working from home. And with time, they started enjoying it. Like they know my schedule and they're like, okay, yes. So with time, it was also fun for them.
So,
And we are
at
still
your job
in.
right now, do you have pay time off? Like, can you go on leave? Or
Definitely. It's still the same benefits. I have paid time off, I have sick off. There's parental leave. There is
FMLA,
yes, FMLA. We have all the
health
benefits.
insurance?
Yes, the life insurance, health insurance, everything as is included. Pension, your 401k, everything is included.
Wow. Wow, wow. Because I know some people will come and ask that question.
Oh,
That
we
is
have
there
all
benefit
the
attached to the job? Like if you are getting the job, is there benefits and all that?
Mhm.
Wow.
Yes, there is benefits. Yeah.
Thank you. Thank you. Thank you. In fact, as I'm interviewing you, I'm like, oh, you two must go
Okay.
hide. I know what it means. I know what it means to have that work-life balance. And I know you actually, because we are friends, the way you went that way, like you actually wanted it. And I'm glad you are living your dream. I'm glad it's fulfilled. Yeah. So my audience, if you have any comments for La, you can always put it in the comment section. She will be there even to answer your questions. And don't forget to like, don't forget to subscribe, don't forget to share with people that have interest in nursing informatics. Thank you. So, what advice do you have for my audience? Maybe people trying from Africa to relocate to the Western world, what kind of advice do you have for them?
Yes. If you are still planning to relocate, I will tell you to just do it. It's worth it. Like, this is a any anywhere aside right now, what is happening back home in Nigeria, I will use Nigeria as an example. Anywhere aside from Nigeria, your dreams will definitely come true. So if you are trying to come into the United States, I will tell you to just do it. It's definitely worth it because we have there are resources. You have everything at your fingertips. All you need to do is just to reach out and grab it. So if you want to relocate, any way you want to do it, as long as it is legal, just do it.
I love that. As long as it is legal, so that you won't be running elter skelter when
Mm,
you get there. And as
yeah.
professionals, it doesn't really worth it,
Mm-mm,
because back home you are a professional and you are earning your money, you have a good job. So trying to relocate as a professional in a legal way, it doesn't worth it.
mm-mm.
Or if you do it the right way, the legal way, is it going to be easy or true? No.
No.
But eventually it's going to worth it, because it's going to
Yeah.
cost you a lot. It's going to
Mm-mm,
cost you money, time, resources,
yeah.
because all these things you have to read, you have to stretch yourself beyond limits to be
Mm,
able to get there. But when you get there, eventually you'll be glad you did. That has been the story of everybody that have been on this channel. They've always been saying that if you have the dream, not everybody have the dream, but if you
mm-hmm,
actually have the dream, then pursue it. Dreams come
mm-hmm.
true, and we are evidences that dreams come true.
Yes.
Thank you for coming. We are going to stop here. Do you have any question for me?
Um, no, I just want to appreciate you for everything you've been doing, for bringing us nurses out there. And I pray that you get more understanding and the Lord will continually replenish your wisdom.
Amen. Thank you. So we are going to stop here. Audience, don't forget to like, share, subscribe, and hit that notification button to remind you and notify you whenever we have a new video. We are going to stop here for now. Thank you. Thank you, Fola. My regards to the family. And thanks
Thank
for
you.
honoring my invitation. I know there's work-life balance. I know you have you have the time, but I know you have a lot of things doing. Like you would have a lot of things you want to do, but you still deem it fit to grace this occasion to come and talk to people. Not everybody wants to tell people what they are doing in their private life, so I appreciate this. I appreciate you wanting to mentor the next generation of nursing informatics people. Thank you. And we are going to stop here. Bye. Take care and
Bye.
enjoy the rest of the day.
Bye.